Daily Facebook update. This morning we will be joined by Dr. Bob Lutz with Spokane Regional Health District. He'll be speaking about the local COVID-19 pandemic here and also the response locally. Specifically, what we are focusing on this morning is the coronavirus-related numbers here locally, the importance of businesses complying with the governor's order, and then also we'll have an update on the screening site and testing.
Well, good morning, everyone. As Patrick said, the three areas we're going to focus on, first of all, is the daily update on our numbers, and I wish that I could tell you exactly that these numbers are correct. We've had a little bit of a technical glitch. To give you an idea about the process, as the laboratories are confirmed, that information is then relayed to the local health departments. They have created a new website, which is also a means by which we can access these data. There were some technical problems over the weekend, and as of right now, I know that we have 143 cases, and I cannot tell you either the number of tests that have been performed or the current number of positive rates. I do know that unfortunately we've had 4 individuals die of COVID-19, and of the 143, as of last count, we had a little bit more than 20 who have required hospitalizations for this illness. The second portion of my conversation is about businesses. We continue to reiterate the importance of following the governor's proclamation last week of stay home, stay healthy. And I think the other addition there is to save lives. Social distancing is imperative if we are going to stay in front and keep in front of this illness. I've emphasized the importance of households and households staying at home, and really making the importance of it's the immediate household. I know this is challenging for families to have grandparents, to have kids that they want to see. I was contacted a couple of weeks ago by someone who has a new child, a new grandchild, and they really wanted to visit. And although I'd love to say that's a good thing, I would say it's not the right thing at this point. And so I think the social distancing message needs to be emphasized. And again, it's that immediate household. It's not your extended household, but it's your immediate household. I talk about businesses, and in public health, we oftentimes use the phrase, make the healthy choice the convenient choice. And I think it's imperative that businesses that are open really provide healthy options for both their employees as well as for their customers. If you are a non-essential business, then you are required to follow through with the governor's proclamation. And so this is essential because, again, people are finding that there are non-essential businesses that are still open. If you're a food service provider, again, takeout is okay, but allowing people to congregate in your restaurant is not. If they're coming in for takeout, again, ensure that they are maintaining that minimum of 6 feet of distance. I would also encourage grocers to limit the number of individuals accessing the grocery stores at a given time. I've been around the community over the last week, and unfortunately I've seen situations where there are a significant number of individuals who are in the grocery, and while there may be some indications that they should maintain their social distance at the checkout, they're doing anything but that throughout the aisles. And so I think it's essential that grocers who are an essential business really follow through with all the guidance around social distancing. And part of this, again, goes back to the gatherings, where a couple of weeks ago, you remember that it was no more than 50 people. That still applies to these types of settings. And so I would really encourage grocers to kind of look at limiting the number of people who are accessing your stores at any one time. Also emphasize the importance of hand washing. We've talked about this many, many times. So again, provide people opportunities to clean their hands with alcohol wash or alcohol swabs, or the hand sanitizer when they're using the shopping carts. Also, I would encourage you to have your checkout people. Maybe they're going to wear gloves, or maybe they're going to have hand sanitizer to, again, as they're handling the food products, ensure that those safe handling processes are performed. And then the last piece is about screening and testing. The weather has been less than supporting some of the outdoor testing that we've done at the fairgrounds. And unfortunately, because of the weather yesterday, we saw that the tent was blown over. And so because of those concerns, we are re-identifying or looking for a new spot for that tent. So until further notice, it looks as if the tent is going to be closed for screening at least until Wednesday. It's our hope that we can have it up maybe best by Thursday. But again, it may be at the fairgrounds, but there are other sites that we are looking that may be better given inclement weather possibilities. As of yesterday, more than 3,000 people had been screened and about a third of those were tested. I think the important thing to realize is that this drive-through site sort of serves as a decompression site for clinics, for urgent cares, for hospitals, so that they're able to take care of other individuals who need to be seen. We're oftentimes asked, people hear about these new tests that are on the market. When are they going to come to Spokane? There is a fast-track approval process by the FDA, but even this morning I was contacted by two vendors, both of whom were saying, Dr. Lutz, I have this new test available. Can I make it available to you? Neither, however, acknowledged to be FDA approved. So there's a great concern about bringing tests into the community that haven't been verified and validated. I assure you that as these tests become available, we will make sure that they are available to everyone. But again, I think it's imperative that we ensure that they are safe and that they are valid, so the information that they are providing is accurate. And then finally, great concerns about PPE, personal protective equipment. I heard today that we received a shipment from Department of Health, 5 pallets worth, some of which is PPE. So those materials are coming into our community, but it is both a local, statewide, and national shortage of PPE. So again, we are addressing it as best we can, but it continues to be a concern. And with that, I will open up to questions.
Thank you, Dr. Lutz. We have a couple of questions here for you. The first question is about recovery. I've heard you speak about recovery a little bit anecdotally at times. Can you provide today's update on what you're hearing as far as individuals who may be recovering from the COVID-19 sickness and having acquired the virus?
Sure. So with respect to recovery, with respect to individuals recovering from the illness, so much of it is a function of how ill they became. We know that approximately 80% of individuals will have either a very, very mild illness or maybe a little bit more severe, like a flu-like illness. And then it's going to depend on whether or not they have any other medical concerns that will affect their recovery. We typically see on the order of 7 to 10 days approximately as to when these individuals who are infected start to feel better if they have had mild to moderate symptoms. Unfortunately, a small percentage of individuals do require hospitalization, and their recovery period is extended pretty significantly. So again, it really comes down to A, how significant the illness has impacted the individual, and then secondly, whether or not there are any other medical conditions which could make their recovery a little bit more difficult.
The next question is about PPE, but more from the perspective of individuals who are choosing to wear masks when they do go out into public. You spoke about this before, but what advice can you give to those that are watching if they do go outside? Should they be wearing a mask? What kind of choices should they make on that front?
Yeah, the messaging around personal protective equipment continues to evolve. Certainly, the World Health Organization and the CDC at this time do not recommend personal protective equipment or masks specifically for asymptomatic individuals. That said, I heard yesterday that the CDC is reconsidering some of that messaging and some of that guidance, and so we may see some changes in that over the coming week. You look at other countries where wearing masks is a normative practice. They wear masks not only to protect themselves, but to also protect others. That's not necessarily something, however, that we see in this country. I think at this point, I can't say that a mask is going to necessarily protect you to the degree that those that are formerly used in hospitals will do, like you hear about N95s, but by the same token, it may provide a little bit of benefit. And so I wouldn't discourage them at this time, but I also wouldn't necessarily advocate them at this time.
And Doctor, we have another question from somebody watching online right now. With more testing, obviously we will be seeing more positive results. Can you talk a little bit about your research and what you've been seeing as to when we may possibly hit the peak at this point?
Yeah, questions about peak are truly speculative, I think, at this point. So, as we've talked about for weeks, we know that COVID-19 has been here, and certainly our increasing numbers to some degree reflect the fact that we are testing more. I think it's very difficult to sort of project out when we are going to see this peak. I've heard that at the national level, they are predicting a peak sometime in the mid to latter part of April, but that's also sort of at a national level. The trends from the Puget Sound area suggest that they're starting to flatten the curve somewhat. That's different than what we're seeing in eastern Washington, where the curve is sharply increasing. And so it's difficult to say, but I would encourage people to think that these types of restrictions are going to be encouraged throughout the remainder of this month, throughout the month of April, and then certainly considering probably including those into May to some degree. Great concerns, I think, exist that if we allow business as usual, we'll find ourselves having to go back. And so I think that as the restrictions are lightened, they will be lightened very, very gently and very, very slowly.
And finally, we have a lot of people that are joining us now that weren't with us at the beginning of the briefing. Can you give us an update on the screening site, where we're at with that, and a message for folks who are planning on maybe going today or tomorrow and what they can expect?
Sure. So obviously the inclement weather yesterday caught people by surprise, and so the tent is no longer up and running, and we are looking to replace that and relocate it. It may be at the fairgrounds, it may be placed elsewhere, but at this point, the tent for drive-up testing has been closed through Wednesday. We hope to have it up and running by Thursday.
Appreciate it. Do you have a final message for folks watching this morning?
Yeah, I think, again, I come back once again to the message about social distancing. Social distancing does not mean social isolation, but it does require us to be going about our daily lives somewhat differently. This does not tell you that you can't go out to the park and go for a walk or walk your dogs, but give yourself distance, give yourself space. And if you are staying home, which again is the message, unless you have to perform essential services, then stay home with your immediate family. That does not include your grandchildren, your grandparents, but really your immediate household. That way, the stay home, stay healthy, and save lives message, I think, can really be emphasized throughout our community. Thank you. So stay tuned, and then tomorrow again, back with you at 10. Thanks.